Now we are going to talk a little bit about cats, because I know that you have many questions about cats too, and about the same condition, the feline atopic syndrome. And this is more or less the equivalent condition to atopic dermatitis in dogs. This is, for instance, one of my patients, Green, with a very severe pruritic condition targeting the face. The cat was always negative. The was on treatment with selamectin, no improvement. Follow a diet based on peas and rabbit. This is one diet that in the US is relatively common for testing food allergy. Didn't change anything. Only mild improvement with prednisolone. And then when you change the dose, you see that start to do better. So these are the typical cats with what we call feline atopic syndrome. The problem with this disease is that compared to the equivalent disease in dogs, it's much more diverse. So they present in many different ways in different cats. Some present with very severe pruritus on the face, some others with dorsal and neck pruritus, some present with these eosinophilic granulomas, some others with symmetric self-induced alopecia. So the diversity of presentations is bigger than in dogs. In dogs, we have differences. It's true. I show you the breed difference. But in cats, the presentation of the feline atopic dermatitis, or now called feline atopic syndrome, or feline atopic cutaneous syndrome, is much more diverse. And we don't know so much about the pathogenesis of this condition. Everything that I explain to my students or to dermatologists is based on data from dogs or from humans. We suspect that there are also antibodies against environmental allergens. We know that incidence is high, but we don't know exactly how high it is. We don't know about breed predisposition. You know that this in cats is much more difficult. We suspect that there is a genetic background of the condition, because it has been reported that in some litter, many cats had the condition. One case was clearly published in 2001. So we suspect that it's similar. It's a kind of allergy, young cats, genetic background, but we don't know all the details of this condition, to be honest to you. Another difference with dogs is that the big majority of dogs begin with atopic dermatitis when they are young, 90%, between 6 months and 3-4 years of age. In cats, this is true for 75% of cats. But then we see a weird group of cats that has not been examined in detail, but about 1/3, 1/4, or 1/5 of the cases, they start to present clinical signs when they are relatively old, when they are 9, 10. And when you talk to the owners and say, but this itching was present years ago, say, no, never. That's something new, and the cat is 10 or 9. So, but this has been clearly identified and reported. We don't know why, if this is a change in the environment or in the immune response of the cats. The allergens that have been identified in cats are more or less the same. So many mites, in many cases, dermatophagoides farini is the main allergen, but also food and storage mites and pollens in some areas are very important. Pollens are much more seasonal, so depending when you test the cat, you will detect more pollens or not. And remember that some are also allergic to food proteins. So in some cats, again, have the two allergies combined. I'm going to skip that one. The mechanism of the allergy is exactly the same: an allergic reaction in the skin. The free endings of nerves send the signal to the brain using the spinothalamic tract and doing a neural change in the thalamus, and then it's the brain that itches. So I always say to my students, it's not the skin, it's the brain that itches. No? But this is similar, and this has been explored a little bit in cats. If we want to look at the clinical aspects before going to treatment, you know well that cats with atopic dermatitis can present with the 4 classic manifestations: face and neck pruritus, miliary dermatitis, symmetric self-induced alopecia, or eosinophilic dermatitis. The facial pruritus is a very common one. And dogs, there are cats that scratch the face, typically the neck, the ears, and that they cause excoriations, ulcers, and cross, in many cases infected. There are cats like this one, with the rest of the body is more or less okay, but they cause these excoriations. The excoriations, you know, this is a erosion or ulcer self-induced, and here on this area, or more severe like this one. There are cats that when they have time, in some cases in the privacy, they go to a secret site and they start to scratch the face desperately, or like this one with very severe pruritus. In some cases, the neck is an area typically affected, so they are cats with very, very bad reactions. And another presentation that is less common, but we see with atopic dermatitis in cats or feline atopic syndrome, is a miliary dermatitis that you know is a papulocrostose reaction that affects typically the neck and the dorsal trunk. There are cats like this one, and this is a cat that you see that the hairs here are not completely normal. The face is perfect, legs and tail too, but when you look here, the dorsum, you see this type of tiny papules with crusts all over the dorsum. It's true that this presentation, miliary dermatitis, is very common with flea allergy dermatitis in cats, but some atopic cats also present with this. Then we see many cats with symmetric self-induced alopecia. This is a classic presentation of the atopic cat. I would say the most common one is the face, and then this self-induced alopecia. There are cats that symmetrically barber different parts of the body. They shave different parts of the body. If we are very strict as dermatologists, we say, this is not really alopecia. It looks like alopecia, but the hairs are there, only that are very short because they are just shaving this with the licking. And you can see symmetric areas of alopecia on the legs. Some cats do this. Or you can have areas of shaving on the trunk and on the legs, like this cat here. You see the abdomen is shaved, the legs are shaved, and the rear thighs are also symmetrically shaved. So they do this work very efficient. Or you can have cats like this one. This is a very common presentation, both sides. 20 years ago, some of these cats were considered maybe cats with endocrine disorders. Symmetric alopecia in dogs at that time was considered simply an endocrine disease. Now we know that these cats simply, they feel itch. They are allergic cats, the majority of them. And so this is the area that the cat is reaching, that is licking. And then we know that there is a percentage of cats that they present lesions of eosinophilic granuloma complex, either the classic eosinophilic granuloma, linear granuloma on the posterior thighs, or eosinophilic plaques on the abdomen and groins, or the indolent ulcer on the lips. I think that you know this condition. This is the classic eosinophilic granuloma of the tongue, we see in allergic cats. These are the beautiful plaques on the abdomen. They are exudative, erythematous and exudative plaques located on this area of the abdomen. When you look closer, they are raised plaques that are very exudative. You can do a cytology of these plaques, and from the 3 lesions, these are the lesions that are more eosinophilic on the cytology. If you do a cytology of these plaques, you will see many eosinophils. That's another cat with eosinophilic plaques. Looks happy and normal, but when you look, you see the cat is licking this area, has removed the hairs from all this area, and we see these beautiful raised erythematous plaques. And when you simply do a cytology of these plaques, you see this. Many eosinophils, beautiful feline eosinophils. Okay? And then the last type of eosinophilic granuloma is this indolent ulcer. There can be both upper lips, it can be like this, or even in some cats like this one, very, very deep, very necrotic with fibrin in the middle. And that in many books they call this rodent ulcer because it's located here where the canines are. It's interesting to know that, at least in this study that was published a few years ago, many atopic cats present with different presentations. So they can, about 40% of cats with feline atopic skin syndrome, they have more than one of these clinical presentations. They can have eosinophilic plaques and alopecia, face pruritus, and maybe self-induced alopecia, an eosinophilic granuloma, and maybe alopecia on one part of the body. I don't know why I have this noise all the time. Crack, crack. See if I can stop it. This is one example of this. You see the cat is having this, we have seen this miliary dermatitis, but when you look the entire cat, you see that it's also leaking this area of the body. So more than one pattern is relatively common. And also we know that in dogs, these cats with atopic dermatitis, they can present with some other clinical signs. About 40% in 2 studies, they presented some GI signs. Some can have sneezing and respiratory signs. Although there has been several studies trying to connect asthma in cats that you know is very frequent with atopic dermatitis. A clear connection has not been established. In children, it's well known that there is this atopic march, that children start with having atopic dermatitis and at the end they have asthma. But in cats, the connection between atopic dermatitis, inflammation of the skin, and pruritus, and asthma is not clear. So many dogs with asthma do not have previously signs of atopic dermatitis. But it's true that some cats can have more than simply skin issues. They present with respiratory issues, with a lot of respiratory distress, especially those with a lot of inflammation on the face. Interestingly, in cats, these presentations of facial pruritus, miliary dermatitis, eosinophilic granuloma can be consequence of 3 different diseases: flea bite hypersensitivity, food-induced hypersensitivity, and atopic dermatitis. So the 3 allergies, they can present exactly the same. So we do not have a way clinically to say this looks more like flea allergy or atopic dermatitis or food allergy. In dogs, it's easier because flea allergy dermatitis tend to be more dorsal-lumbar or inguinal, almost never targets the face. So at least fleas can be separate, and food and atopic dermatitis, they look similar. But in cats, the 3, they can look exactly the same. So the only way to diagnose a feline atopic dermatitis, it's doing a diagnostic protocol. So simply, like we did in dogs, begin ruling out infections and parasitic diseases, notohedric mange, otocariasis if the cat is scratching the face, Klebsiella, if it's dorsal, for instance, the miliary dermatitis, demodicosis, and we will do skin scraping, Scotch tape test, even consider Woods lamp or fungal culture if there are miliary lesions. And we will begin a treatment for ectoparasites in any case of a cat with each or one of these lesions. And then once the parasites and infectious diseases has been ruled out, we will move to discuss the allergic dermatitis. We will try to be sure that there are no fleas and the cat is on good flea treatment. And then we'll do a food trial to rule out food intolerance or allergy. And this is the same that we have discussed previously, 8 weeks, a very strict diet. In cats, this is even more difficult to do than in dogs, because in some cases you have several cats in the house, they go outside and eat different food, or they hunt. So if the owner is not going to do a good trial, skip this, because it's a waste of time to try to do a food trial if the cat is eating everywhere, going outside, eating garbage from the neighbor, doing dog food, because we don't know if the food it's part of the problem or not. So we have to accept that cats are difficult to manage, and then we don't need to ask things that are impossible. There are people that have 4 cats in the house and they're eating different things. And there are cats that are food allergic, and in some cases, if you do the good trial, you will be able to detect them. This is one of my patients, the American patient, and this, for instance, was allergic to tuna fish, and there was clearly, every time that the cat was exposed to the cans with tuna fish, developed this rash on the face. But this is not very common. There are many cats that are, many more that are environmental allergic with some tiny food component. So when you have ruled out food allergy, then you are allowed to diagnose feline atopic syndrome. And then you need to begin a treatment. In cats, it's a little bit different than in dogs. We have some things in common. The first one is that we need to prepare a long-term strategy. They need to be always on good parasite control. They need to eat a high-quality diet. If possible, some of the diets that we have for allergic cats. And they need to be followed really frequently to assess the presence of secondary infection, the side effects of the medications that we're going to use, that you will see that in cats are much more aggressive and less, let's say, studied than in dogs. So we need to monitorize this cat really frequently. So what are the options that we have? We have several options in cats. The problem is that only 2 of the options have been really well validated with randomized control studies. There are some other options that are also good. There are publications for these options, but still we lack very good evidence of the, say, efficacy and safety of these medications. So we will talk about all these treatments. So glucocorticoids is the easiest one. They are relatively effective and really fast. The problem are the adverse effects. You know that they can have cardiac issues. They can cause diabetes on the mid and long term. They can cause immune suppression. So in general, on the short term, they are safe, but they are difficult to be used on the long term. Remember that in cats, we do not use prednisone. So many cats, about 40% of cats, probably more, they are not able to change or to transform prednisone in prednisolone. You know that prednisone is not the effective drug. It's only a prodrug. Needs to be changed by hydroxylation here in this carbon here to prednisolone, that is really the effective medication. We humans and dogs do this hydroxylation very easily. And therefore, in humans, prednisone is the drug that is used, cheap and convenient. The same in dogs. But many cats fail to do this change. And then if you give prednisone, some cats do not respond well. So we always use prednisolone. And if prednisolone is not the drug that works, then we try these other options. The dose and choose the election of a steroid has been published and the studies very well by this paper by Evagans in California, and the dose is very well established. So for allergic cats, this is doses for allergy. The option is to use prednisolone of 1.5. I usually start 1.2, 1.3 milligrams per kilogram of prednisolone. If you use methylprednisolone, Urbazone in many countries, that's absolutely okay and fine. It's less mineralocorticoid effect, and you can reduce about 20% the dose. So methylprednisolone is about 20% more powerful than prednisolone. Now we are using a lot of dexamethasone because there are evidences that in cats it's probably even a better option than prednisolone. And last year there was this feeling that was in the community of dermatology saying, well, every time that I use dexamethasone in cats, they do very well. With prednisolone or methylprednisolone, I have more issues. This feeling was published and they documented that is a very good option to use dexamethasone in cats. The problem with dexamethasone is that it's really powerful and the dose is 8 times lower than the dose of prednisolone. So I usually begin, in this paper, they use 0.2 milligrams per kg a day. I use 0.15 and it's more than enough in most cats. So, and dexamethasone, I know you are aware of that, is a drug that lasts for almost 3 days. So you can at the beginning give every day for 3, 4, 5 days, and then simply every other day, and then even every third day, because the effects of dexamethasone are really low. It's a very good option in cats. The problem with steroids is that on the long term, they are going to create problems. Even if you reduce the dose and even if you give the dexamethasone every third day, usually you see that the cats start to have higher glucose levels, that some of them have some respiratory distress. So it's usually necessary to find an alternative. The best alternative to move from steroids to a long-term management of allergic cats is cyclosporine. Cyclosporine has been well studied in cats. The initial paper was published 10 years ago already. It's registered in Europe for use in cats, so we are doing something that is completely legal. And the dose is a little bit higher than in dogs. It's about 7 milligrams per kg a day. There is a solution or several brands that produce cyclosporine, and it's not so effective as steroids. And this is the paper showed that there are differences, but it's a very good option for treating cats. And usually I begin with dexamethasone or prednisolone or methylprednisolone, and I change to cyclosporine if I see that the cat needs constant medication, that is not a single flare or seasonal flare. Before using cyclosporine, by label, you have to check that the cat is FIV, feline leukemia virus negative, and also the register at the European Medicine Agency say that you cannot use cyclosporine if there is neoplasia or active infection, and also that you have to be careful with toxoplasma. The label says only these 3 things. There is no mention to toxoplasma. So your obligation is to be sure that the cat is feline immunodeficiency leukemia negative, test the cat, and that is not having an active neoplasia or active infection. But we know that there are cases of toxoplasmosis, very few, but there are reported cases of toxoplasmosis in cats taking cyclosporine, as we have cats having toxoplasmosis when they are taking steroids. There are a few cases, 2 at least published, and one of them was taking steroids and cyclosporine at the same time. So we don't know if these cases are new infection with toxoplasma or active reactivation of the toxoplasmosis. And also, it is suspected that these cases are the consequence of cats that absorb a lot of cyclosporine and have very high levels of cyclosporine on blood. At least these are the studies that have been done. In fact, Michael Lapin tried to induce toxoplasmosis in mice, in this case, giving higher dose of cyclosporine, and then in cats. And they detected that the cats that start to activate the toxoplasmosis is because they have very high levels of cyclosporine, and not because of the immune suppression caused by the normal levels of cyclosporine. What I do with toxoplasmosis, I simply recommend the owners not to allow the cat to eat raw food, table scraps, hunting. I simply give the cat only canned food or dry food during the treatment with cyclosporine. If they are really concerned, one possibility to be safe is to check the cyclosporine levels, to take a sample after 4 weeks of treatment, send to the lab. Usually we measure the levels of cyclosporine 2 hours after giving the liquid, and see if the cat has very high or very low levels of cyclosporine. If the levels are too high, I reduce the dose a little bit to 5 or 6 milligrams. Another possibility is to do serology for toxoplasmosis, but in most cases, it's not useful unless you are going to do constantly serology. Because if you do a single serology, if the cat is with high levels, you know that it's infected and can be reactivated. And if it's negative, it can be exposed to new infection. So in both cases, you will need to do more tests. So there are some owners that request that, but for the majority, I simply give these instructions, and it's according to the law and to the register. I begin with 7 milligrams per kg every day, always with food. You can give cyclosporine to cats in 2 different ways. You can mix in the food and give it to the cat. Some cats eat that. You don't have to mix it in the presence of the cat because they are very smart, and they say that you are doing something to the food, and they say, I don't like this. Well, what are you doing with my food? I will not eat that. So do this hidden. Or you can simply put in the oral cavity. In some cats, one thing works, and in some others work the other thing. So when you mix with the food, the risk is that some cats go, smell the food, and say, here is something wrong, I don't want to eat. When you put in the mouth, this cannot happen, but some cats, begin to do this foam and this hypersalivation, and they spit the product. So you have to try what is best for each cat. Usually it's better to use the solution than the capsules, but I have some cats that they prefer the capsule hidden with food. And you can at the beginning use the prednisolone to accelerate the signs of cyclosporine. So you can begin with prednisolone and cyclosporine, and then you discontinue the prednisolone and continue. And you can do the test when they are on cyclosporine. Problem are the side effects. In a series of 50 cats studied when receiving cyclosporine, you see more or less 20 of them had some side effects of cyclosporine, 20-something of them. So it's relatively common that they develop clinical signs like vomiting, diarrhea. Some are less important, like tartar and gingivitis. Probably this is not related to cyclosporine. Like in dogs, if the cat develop adverse events, do not be completely desperate. You can try different things. You can stop the treatment for a few days and restart. You can split the dose because you are giving a liquid. It's easy to give a small amount in the morning, a small amount in the afternoon. You can try the capsules instead of the solution. You can freeze the capsules. There are different options to go with this. If you are completely desperate and every time that you try to give the cyclosporine, the cat starts to make foam and saliva, the one option is to use the subcutaneous administration of cyclosporine. I have only done this in a couple of cats. The truth is that it's not very easy because you need to give injections constantly. And then even if you give the injection every 2 or 3 days, they need to come frequently to the clinic. So it's not an easy way, but it's true that they demonstrated that using the same solution of cyclosporine subcutaneously, you can have the same results in cats that are impossible to medicate. So now we move to other options to manage these cats. These two are really well documented. There's a lot of evidence, publications, and data. Then we have a group of therapies that are not so well documented. Number one is allergen-specific immunotherapy. Now there is a lot of interest in this treatment. The efficacy is about the same that in dogs, between 50 and 70%. It's very safe, but in cats it's a little bit more difficult to implement because if you repeat injections frequently, they learn that you are catching the cat, giving the injection, and some are really in stress. The system is the same. You need to identify the allergens with the skin test, or in cats, we tend to use the serum test in most of the cases, and then choose for immunotherapy the allergens. And if you use the sublingual route, we usually give twice a day the solution, in the morning and in the evening. And many owners prefer that than the injection for the cats, like in children. So they prefer to give the sublingual route daily in the morning and in the evening. And again, you need to wait 9 months to evaluate the results. This is a very recent publication in 2021. They showed the efficacy of sublingual allergen-specific immunotherapy in cats. And you see that the cats improve with different type of lesions. They improve really quickly, and they have a progression. This, you may say, why you say that there are no evidences that if there is a paper recently published about the efficacy of immunotherapy. This is an open study. So they took 22 cats, started to do that, and they say, oh, they are doing well. But there was not a control group. So maybe these cats were doing, some had other medications, but maybe they were going to do the same without immunotherapy or only with the complementary treatment, only with parasite control because of the period of the year. So it's good to know that the immunotherapy, it's useful, and I try always immunotherapy, but it's true that also that we need more evidences for being sure how effective is this treatment. Another treatment on the list of those that lack evidence is antihistamines. You asked me about that before. I think that the efficacy is very limited in cat. There are different studies. In 2 of them, they show 30 and 40% of some efficacy in some cats with chlorpheniramine and cetirizine that that are first-generation antihistamines. Probably this was more related to the sedating effect than really to the really antipruritic effect. Another option that we have in cats is Apoquel. Apoquel is not registered for use in cats. So when you begin to use Apoquel in cats, you know that you are doing something under your responsibility. Because if there is an issue, the owner will tell you, why are we using this drug? I say this is only for dogs. And you need to explain that, yeah, it's not registered for cats, but in your cat, I'm desperate, the immunotherapy is not working, the cyclosporin is not well tolerated, I cannot give steroids forever. So you need to explain that. There are so far 4 studies published about the use of Apoquel in cats. So this has been explored and published and investigated. The last recommendation is to use a dose of about 0.75 milligram per kg every 12 hours. We know, we published this first study about the pharmacokinetics of Apoquel in cats in veterinary dermatology, that we know that the Apoquel in cats, when you give the tablet, works more or less the same that in dogs. It's absorbed very quickly. The maximum concentration in serum is about 1 hour. So we check this when was giving oral or IV. So you see, it's more or less the same. It's absorbed quickly, high concentration, 1 hour, and then drops immediately. If the levels are below this 100 here, concentration nanogram per ml, the Apoquel is not effective. And this happens relatively quickly, before 10 hours in cats. So we are quickly below levels. So in cats, probably we need to give the drug twice a day to maintain a good control of the itching. And if you do this, you give the drug twice a day, there are several studies showing that it works. That, for instance, in this study done in Italy 2 or 3 years ago, they were using around 1 milligram per kg twice a day, and they showed that was similar to methylprednisolone in efficacy, more or less. Not as good in some cases, but in some others was more or less the same. And this is a recent publication in 2021, and you see that this is published in Journal of Feline Medicine and Surgery. You see that the pruritus drops quickly. This is first week, second week, third week. So, and here are the lesions, again, first, second, third week. So in many cats, Apoquel works. But Apoquel had some issues. First, we have already seen a publication regarding toxoplasmosis in one cat treated with Apoquel. In this case, the problem for the vet is higher because the owner will ask you, and why are you giving Apoquel to my cat if it's clearly not registered for cats? So you can be in a more difficult situation. Also, in the last European meeting of dermatology that was 1 month ago in Porto, there was a session one afternoon devoted to Apoquel in cats, different discussions. And one group presented cats treated with Apoquel, long-term, allergic cats. And they said, we don't see anything. Mild changes in enzymes, liver enzymes, changes in cholesterol that we know because this is a consequence of the interleukin-6 block. A few things. It's safe. We have not had any problem. Another group came and said, I have relatively good results, not as good as in dogs. 60% of cats more or less respond well to Apoquel. And then there came people from Zoetis and they say, well, I know what you think, I know your data, but we are not going to register Apoquel for cats because our studies are not completely, let's say, reassuring that this is safe. We still have some doubts about the safety. So we are not going to register Apocal for cats, and we do not recommend the use of Apocal in cats. So this is the current situation very recently. Apocal is an option, but I will say we need to have very good reasons to use Apocal in cats. So you need to be sure that this, with the steroids you cannot manage that the cat is on good control, that immunotherapy have been tried and is not working, that cyclosporin is not an option. In this case, if you are really desperate, you can try Apoquel and try to discontinue or go to the lower dose as soon as possible, because apparently there are some issues of safety that I have not seen. I have been treating cats with Apoquel for years, and not many, because I prefer to use immunotherapy. But it's true that in some cases I use Apoquel because I do not have options. But if you can change, do it as soon as possible. Another option that you can use is maropitant. Maropitant, you know that it's an antagonist of neurokinin 1, that is the receptor for substance P. And this, when you create the signal of pruritus in the skin, the signal moves to the dorsal root ganglion, goes to the spinal cord, and then goes to the brain. In the neurons here, in the neuronal connection here, the mediator is the substance P. And maropitant blocks that. We know that. And there are very good studies showing that apart from preventing vomiting, it's antipruritic in experimental models. There are no big studies showing that maropitant is antipruritic in cat, but at least with maropitant we have an advantage. We know that it's safe and it's registered, because it's just registered in cats for vomiting. So all the data are in the European Medicine Agency, and you are allowed to prescribe maropitant to cats. So it has an indication. Yeah? So it's good. So therefore, some people try to use maropitant in cats, and this publication in 2018, where they use maropitant as treatment for allergy in cats. At the regular dose, they use it in 12 cats at the regular dose of 2 milligrams per kg. That's the dose that it's in the label for 8 weeks. Yeah. It's true that in these cats, they use other treatments. They combine with oclacitinib, cyclosporin A, methylprednisolone. So it's difficult to know how much helped. The authors of this paper, they say that it helped a lot. So you see the efficacy is in blue. In some cats was very high, in some others, maybe in 4 or 5 of the 12, was really moderate. So these are the data. I have been talking to both Elisa and Jack, and they say it works. It's an option that we have. It's a little bit expensive if you are going to use maropitant on the long term, because maropitant is designed to be used for a few days when the cat is vomiting. You are not supposed to give maropitant every day for years, because it will be pretty expensive at the end. But they say that it can be helpful at the beginning to help to control the itchiness. In my experience, I have tried many times maropitant. The difference is very tiny. I have not seen good effects. I have never had a case of severe atopic dermatitis being controlled only on maropitant. If added to other drugs helps, to me, it's difficult to identify. And finally, a couple of years ago, a French group of behavioralists published this paper on the use of, let's say, behavior modification for allergic cats. This is something that has been on the community, on the dermatology community for years. and that in many cases, I'm sure your clients have talked to you about that. They say, well, this is because of the stress. My cat is probably when he's under stress, more people in the house, changes in the environment that starts to itch more. So we know that there is a connection between stress and allergy in many different models, but these people try for first time to approach that in a, let's say, more scientific way. So they develop a scale of welfare from 1 to 21. So 1 or 0 was a cat with very good welfare, happy cat. 21, poor cat under stress and anxiety. These are not dermatologists. They are a group of behavioralists. And they investigating cats with ulcerative itchy dermatitis, they identified that the cats with ulcerative dermatitis usually had high scores in the welfare scale. So they were in poor welfare conditions. And they said, okay, it seems that it's true that the cats with allergy, at least those with ulcers on the neck and head, they are in a, let's say, poor welfare condition. It could be that this, instead of be the cause of the allergy, be the consequence. They are in poor condition because they feel itchy because of the allergy. But they say, let's do a trial. So we will only treat these cats with behavioral interventions. So we will increase the welfare of these cats to see how the allergy changes. We will eliminate frustration and increase the control over the environment with permanent access to food and water, going outside freely with more toys, what they call an enrichment of the environment. They improve the human relationship. They gave clear instruction to the owners about how to interact with the cat. Let the cat, do not go and catch the cat and pet the cat. They modified the cat-cat relationship in houses with several cats. They eliminated the competition, created new areas in the house. In the paper is very well this reported, you can read that. I'm always now including this recommendation in all my reports to owners of allergic cats, and they had very good results. So after 15 days, 12 out of 13 cats improved clearly only with these interventions. So the lesions and the pruritus disappeared completely. The welfare index dropped from 16 to 6, and they continue with this. Many occasions they added pheromones, Feline, and so on. And according to the study, a very effective approach. So what I do now is I try to recommend, together with the classic treatments, this intervention. So I have a paper, a document with the recommendation, say, yeah, you will do cyclosporin and you will do this. You will do immunotherapy and you will do that. And finally, I was asked about desperate cases and what if nothing works? Well, if nothing works, there are always a few alternatives, like in dogs that I mentioned. So there are just cases published of isolated drugs that can be used. Gabapentin, again, in cats has been useful in a few cases. Usually, when it works in the publications, is at the higher doses, close to 20, not the lowest one of 10. And in some cats, you need to give it 3 times a day. So it's pretty intensive, but it's an option. Topiramate, it's also another treatment for these cats with ulcers. And there is only one paper showing that. The topiramate is an anti-epileptic drug. Again, has to be given twice a day, but it has been shown that in cats, long 4-6 weeks can help to stop the itching situation. And I think that's it. So if you have questions, I will be more than happy to try to answer them. Yeah. Good. Microphone.
I have a couple of questions. And is there any data on connection between eosinophilic keratitis and eosinophilic cat atopic syndrome?
We don't know for sure. What we know is that there is a predisposition to develop eosinophilic reaction in some cats. And this is genetic and is related to interleukin-5. So we know that there are cats that tend to have more eosinophilic reaction, eosinophilic keratitis, eosinophilic dermatitis, eosinophilic granulomas. But we don't know if this is always the same or one cat develop one or the other. But it's possible to grow a colony of cats that tend to develop these eosinophilic problems, eosinophilic keratitis, eosinophilic dermatitis. At least one colony was developed in the US, and they had occasionally the eosinophilic reaction. So we think that in the basis there is one mechanism. Okay.
In some cases, could clogged tear ducts be a problem with a pruritus, the main cause of a pruritus of the eye?
The clog of the?
Tear ducts. Tear ducts.
I don't know.
Okay. As you see, I have pretty bad blood with ophthalmologists, so the next maybe will be, I have plenty of patients sent by ophthalmologists with only one pruritic eye. Mm-hmm. There is no any of signs of temporal pruritus or
only on the eyes, yeah?
Only eye, yeah. And ophthalmologists see there is no problem in the eye. Have you so many patients with that?
No, probably they are seen in my hospital by the ophthalmologist, so I cannot help you about that. Sorry.
Yeah, but it's pruritic, so
yeah,
ophthalmologists sending it to me almost all the time.
Yeah, no, I have not seen that. Sorry.
Okay. Okay, and based on your experience on Apoquel, I know what you will say, but I will try it. Yeah. If you're thinking about using drugs on atopy in cats for a long term, it's 3, 4, 5 years or something like that, would you choose steroids, only option in this case of controlling pruritus, or another option which works to Apoquel? We're not talking about cyclosporine or acid or something like that. 2 options only.
2 options only. I would probably go for steroids first. And then if I see that the blood glucose and the fructosamine test goes up, then I would change to Apoquel. But I will probably try steroids on a long term to see, because some young cats tolerate the steroids relatively well. So I will probably begin with that, but I'm not sure that in all cases I will do the same. What do you do?
It depends, but I'm go mainly in Apoquel if it works, but it's only my experience. And the last one, it's
difficult because, as I told you, that there was a big discussion about Apoquel, and nobody is absolutely sure of what is the best. And I have published 4 papers on Apoquel in cats, and I was the first one showing the pharmacokinetics. So I'm used to use Apoquel, and I know about the mechanism of action, everything. But despite that, the people of Zoetis is so clear about not use Apoquel. It was difficult because they say to us something like, don't use it. And say, why? I have not seen anything. I have been using cats. People present, they say, don't do that. Believe me. And then it's difficult because they don't give all the information. They don't tell you, we have seen this, and then you can assess the importance of that and answer your question if I prefer the steroids or Apoquel based on data. But I have to base my decision on the comment, not on the data, what they told us.
And what is the optimal blood check examination cylinder? Or
what I do with Apoquel in cats, it's the effects that we expect to see, the adverse effect that we expect to see in cats are two. One is changes in biochemistry, so increasing cholesterol in liver enzymes, and the classic one that is neutropenia, because we know that Apoquel is not completely selective for Janus kinase 1, affects a little bit Janus kinase 2, and then they start to have decrease in polymorphonuclear neutrophils. So this is what I do. I begin doing this every 2 months, and then if they are doing well, I do less frequently, every 4 months, and then twice a year.
I see often anemia in dogs, but never in cats.
No, in dogs we see anemia and neutropenia. What we see in dogs, when I began to use Apoquel in 2013 in the US, we didn't have so much information as now we have. So I was scared using this dog on the long term. Zoetis said, you don't need to do blood work, it's safe. We have done this, but because it was new, I did many blood works every month or every 2 months to all the dogs, 10 years ago, 9 years ago. And what I saw is that in some dogs, they don't drop to the area of anemia to call it really anemic. But if you begin with 8 million, after 6 months it's in 6 million. It's still within the range, but you see that something is changing. And the same with neutrophils. You begin a dog with 5,000 and say, okay, good, fantastic. And after the 2 months, it's 4,500. And after 6 months, it's 4,200. And after 1 year, it's 3,200. Above 3,000, it's normal, but you see some effect. And probably what happens is some specific dogs or cats are more sensitive and they start dropping a bit, they drop like this. This is the anemia that you say that you have seen.
And in this case, you change the drug, or you are making a pause?
No, if you are within the limit and one control, I usually continue, because changing drugs in an atopic patient that is well controlled is always a risk. We need to have a good reason for doing that. Sometimes the owners, I'm sure you have the same situation. You have a dog control with Apoquel, say, well, but I need to eat the pill every day. I heard that now there is an injection. I say, we can try, but now the dog is doing well. I cannot promise that we'll do well on the other medicine because we don't have a way to, let's say, anticipate the response to the dog. And then you can have a dog that is not responding. Thank you.
In the same topic about the stress of cats, and really I would like to do a little interpretation of colleagues' question. It is very sad to see cats when they treat only with a medicine like steroids and never Apoquel, but Apoquel, and no choices to try alternative therapies, and to do very, very serious focus on the stress. The stress is not a little bit from my experience, because I do dermatology over 20 years. And what I notice, last 5 years, we start to focus on feces and microbiota of feces and the quality of the food. When we have these atopic cats, we starting to look at the feces. And most of cats have a lots of not normal microbiota, even pathogenic microbiota in the intestine. So the stress is not only very bad conditions. The cats lives in very nice conditions, but the family got the baby. And we have cat without the hair. It's itching and stressed, and we see the atopic things. We start to treat only with steroids. We will just destroy the cat. I agree with me. And what is your experience with intestine stress on not very severe stress?
No, I'm sure that there is a connection, and this has been well documented between the GI tract, GI microbiota, and the skin microbiota. They are interconnected. So now there are even studies, and we have been working with the microbiota of the skin and GI tract, and that's for sure a connection also with the stress. And I think it will be ideal to address the situation like this, considering the welfare of the patient, all the GI signs and everything. The problem that I see on the real world is that the people have limited time and they expect very quick improvements. And then at the end, what they are demanding is fix it quickly. And only steroids do this. Basically, in dogs, we have one
mechanism. Yes, we're talking about the medicines for years.
Exactly.
So it's then, killing the cat.
Exactly. And then this fix for a few days, and then there comes the frustration again. So ideally, we should, from the beginning, talk to the client, explain what are we going to do, that this modification of the diet, of the welfare, will be essential for the mid and long-term control. But sometimes it's so difficult to do that because the vet has no time, the owners don't want this, and they end with this cycle of frustration, steroid improvement, back again to the same, even worse. Steroid has an impact on the microbiota, so all this makes situation more difficult. But I agree that it will be ideal to have a more integrative.
Yes, I agree with you. And the experience is that I've got several cats was treated 2 years with steroids. We fixed it in 1 month.
Yeah.
Without reversing, just we check the feces, put on the medicine, and it disappears. So it's it's not mean that it's a lot of explanation or just
changing the no. I told you, in every cat that we make the medication, I include a part of the treatment, say, welfare recommendation, because many people do not know how to treat a cat. They think that are like dogs, they catch the cat, they try that. We know that this creates a stress to cats, that they need to be free, decide. So there are very numerous recommendations for increasing the welfare, the food. If they do this, if they follow my recommendation or not, I don't know. Depends. There are people that are really focused on the cat and some others do not. Any other question before the break? No?
Aš norėčiau 2 klausimus užduoti. Pirma, ar nepastebėjot? Pirmas klausimas norėjau paklausti, ar nepastebėjot, kad omega-3 šunims kai kada sukelia dar didesnę alergiją nei prieš tai buvo, o katėms atvirkščiai padeda?
No, I cannot tell you that I have seen that. It's difficult to assess the efficacy of the omega-3 because usually we use this in combination with other drugs. So at least I have not seen a difference between dogs and cats on that. Not me.
Ir dar vienas klausimas būtent dėl paveikslėlių, ten kur katė 24 piešinys, foto. Dažniausiai tokios katės būna 5-6 metų, dabar jos atjaunėjo 4 ir kažkur 10 metų jiems dažniausiai būna, mano pastebėjimas, inkstų nepakankamumas. Ar pas jūs tokia teorija surišama, ar jūs nesurišat, kad čia yra tik alergija ir atopija? Kraujo tyrimai prieš tai neparodo ilgą laiką. Diagnozė išryškėjo už 5-6 metų.
And what is the question?
Norėjau paklausti, ar kad 24 paveiksliukė, būtent kada praplikęs pilvas, dažniausiai būna katė jis praplinka 5-6 metų, o iš mano pastebėjime tokias katės būna instinktininkai 10-11 metų sulaukęs. O prieš tai tyrimai ilgą laiką palieka, kad gyvūnas sveikas, kad jis neturi inkstų nepakankamumą. Ar pas jūs nėra tokių domenų, ar jūs nesurišat vienas su kitu?
Not clearly. I agree that cats develop, some cats develop kidney failure when become older, but I have not seen the connection between atopic cats and cats developing kidney failure. So I'm not, in my cases, I have not read that, but I cannot exclude this possibility that the atopic cats have more predisposition to develop kidney failure when become older. I have not seen the data, but I cannot say no. I don't know.